Mike McCool here. I'm in the Royal Examiner studio, and with me today is Gary Kushner. Gary has been with us a couple times, has a lot of information to share, and it's at least a good conversation starter. That's what I like about it. It gets you to think about, whether you agree with Gary or not. I think it opens up the conversation. And we've been talking about, opening up America and opening up Warren County, the state and county, and now the town. So, and I know you've got some opinions to share with us, so I'd like you to hear them.
Yeah, I do. And you mentioned about that sometimes people agree with me and sometimes people don't. And I typically am in the minority, but that doesn't make me wrong. You know that?
That's right. That's right.
Strangely enough, in this case, I think I'm in the majority because I think you'll see more and more of the citizens who are coming out and saying, we've had enough of this. It doesn't make sense anymore, and it's time to get back more towards normalcy.
Right.
So
everybody's calling it the new norm. I don't like that word.
No, I don't. I kind of like the old norm because it seemed to be working for a lot of people.
That's always the thing is how's that working for you?
Yeah,
that's what I've always asked. Well, how's that working for you?
It's not working for me very well, which is why I'm sitting in this chair right now.
Well, give us some of your ideas.
Well, usually when I come to speak, I'm very well organized and prepared. But I'm just so upset about the state of affairs that I haven't been able to take the time to really do that. So I've just thrown some notes together. So, whether this is a cohesive conversation or rambling, you'll just have to put up with it.
Well, we'll do that.
I sent a letter into the Examiner back in the middle of March when all this started. Mm-hmm. And it was titled, "Is the Cure Worse Than the Disease?" And, unfortunately, I think the facts have shown that I was right, that my crystal ball was working back then. And I want to spend some time making some comments that I hope that the local government will hear, that the state government hears, and maybe throughout the damn country, that they say, hey, wait a minute, this is reality what this guy is saying, and let's start pressuring our representatives and make life better for everybody.
Sure.
Because the situation that we have here in the county and in the state is not different than what's happening throughout the whole country. But the whole problem started back when the governor declared his state of emergency. I guess that was about the 17th of March.
Right.
And then he really got organized and he said, well, I've got to clamp things down. So I think it was on the 23rd he made his grand executive order really clamping things down, shutting down normal, as it were. And, he said that everybody, not just the sick and the people at risk, but everybody's got to stay at home. And, schools have to close, and churches have to close, and the public gatherings can't happen with more than 10 people. Actually, it's more than 9. But, and restaurants have to close, and general retail has to close, and recreational facilities, and only essential entities can stay open, and he delineated what they were, If you were a fuel provider, if you had groceries, if you have pharmaceuticals, you could stay open. If you had pet food, you could stay open.
ABC store.
Oh, alcohol. Yeah, and this is going to come back to bite him too because, there's later on I'll mention about how alcohol is affected in here, but not a good idea. And I don't think there's any justification for that other than continued source of state income.
Right. Well, and he shut down like elective surgeries. And really, cancer treatments, they're still doing some dialysis, but they've shut down people I know that were getting chemotherapy. They postponed it. But you could get an abortion, but you couldn't go to church, and I couldn't get any dental work done until just a couple of days ago.
Yeah,
right?
I noticed my dentist is closed, and not that I'm going to go back to him for any more treatments. In fact, I'm going to take a trip to the courthouse and send him some paying paper because he didn't do a good job the last time I was there. So, that the governor put out all these restrictions, and they affected our liberty. Tell people they could stay at home. They have to stay at home. And then you can't go out and be in groups of more than 10. We have a constitution that grants us rights, and I don't see any words in there that says that your right to free speech and redress to the government is limited if somebody's sick, if there's a public emergency. So it's just something we can't continue to have happen.
Well, but the other half says, oh, they're keeping us safe. Are we willing to trade our liberties for safety?
Well, you remember what Franklin said, those that are willing to give up a little liberty for security deserve neither. And I'm definitely in that camp. And I want the government to assist me. I don't want the government to control and restrict me. And that's what our governors attempted to do.
It's almost like you're not smart enough to figure it out, but we can do it for you. Aren't most of the things we're doing just common sense?
Well, I hate to get political, but that's a Democrat trait, that they think that the government has a better idea about how you should run your life than you do. They want to have all these programs out there so that they get people under their control. And, that's just contradictory to how the country was founded, on individual liberty.
Choice,
yeah. I don't want the government determining what risks I shall take. I want them to provide me the facts about issues, and so I can make the assessment of the risk that I want to take in my life. So I've just had a real objection to that. But you're seeing uprisings all over the country now where people are saying, we're mad as hell and we're not going to take it anymore. Look at the people in Michigan with those draconian restrictions that Governor Whitmore put out there, that they can't buy seeds to plant. This is just absurd. So, we've got to stand up and say we're not going to accept this. You're supposed to be supporting this, not reducing our ability to live. Mm-hmm. But, just take a look at Warren County. Just the other day I checked, and we had 103 cases, positive cases in Warren County. There were 11 people hospitalized, and there are 2 people have lost their lives from the virus. That's out of 40,000 people. Mm-hmm. But look at what's happened in Warren County. All our restaurants are shut down except for the takeout and the delivery, and not all businesses are set up for that. So some of them are getting nothing. You've got a big organization like Walmart who has groceries, who has the non-grocery products as well, who can sell and make a lot of money on that. But the stores that have limited products like clothing or shoes, you can't go in and sell them and compete with Walmart.
Well, speaking of Walmart, I was out there. I said, well, how many people can come in the store? 1,098, I think is what he told me. So we can have 1,000 people inside of Walmart, but I can only have 10 people in my restaurant. I can't even have that now. I'm shut down. So.
No. In fact, the first time I called in a carry-out order for breakfast at the Naughty Pine,
right.
The woman wouldn't even let me sit at the counter until my food was delivered. She says, I'll bring it out to you in the car.
Right.
So
she's doing what the governor said.
I guess. Well, you ought to be able to have 10 people in there if they're, physically apart. But again, if I want to choose to, I'm in here with you. I came in and I asked you, I said, are you feeling sick today? And you said, no, I'm in good shape.
I took your temperature.
And I'm in good shape. And you checked my temperature. You see, I had a fever, but I could be asymptomatic.
That's right. You could.
But you're taking a risk and I'm taking a risk, although we're, maybe 5 feet apart here. But, each of us is making that determination on our own as free citizens.
Right.
So that should exist in every level, not just between here and there, but the whole environment within the county. So you take a look at what the county's experience is. It's so minimal, but the impact to its citizens by all the businesses being closed and the people not being able to go to those businesses, because going to a restaurant is part of my enjoyment to life.
Sure, that's your social activity.
It's one of my social activities.
Well, the county and the town, we're talking about the town alone between May to June 30th is having a $2 million shortfall, and going into the next fiscal year having over a $3 million, if I recall the numbers. And meals tax are down, and sales tax is down. The state money to schools have been drastically reduced, and they're going to have another reduction, and it's just a big impact. But obviously we want to say too that this is not diminishing people's value of their life. We don't want people to die. I don't think anybody, you don't want people to
Absolutely
die.
not.
But we just need to be, I think, to realize the impact of people's lives. We already know the powers to be of discussing that, saying we're going to have 75 to 150,000 people just die of things other than the disease because of suicide and alcoholism and drug addiction and things that they're going to do.
General body deterioration. You come in contact with all the other diseases that exist out there that some die from.
Right.
But
I notice that no one's died from cancer or any diabetes or any other diseases. They've all been COVID.
to the contrary, my friend, a month ago my mother-in-law died of the flu.
Wasn't a COVID-19 related case?
Nope, because they tested her and she didn't have it.
Oh.
So, people are dying regardless of the new virus.
Right.
This is just one more event that'll take you out of here.
Right.
But we know who those people are, and it's unfortunate that they would have to be impacted and have their lives disrupted. But why disrupt everybody else and have the whole civilization and fabric of society disrupted when it's unnecessary? Let's only address the people who unavoidably are affected by this rather than everybody, because a lot of people might get sick, but most of them are going to recover. It's only
Right.
the people with underlying health conditions that have the morbidity.
Right.
So
Somewhere I think I read on the news where they had a woman that was 104 years old contacted and survived just fine.
recovered. Hey, I think I recall that she was involved with the flu pandemic.
That's right.
that took a bunch of people out the last pandemic.
Right. 70 years ago,
She
right?
said, "Hey, one's enough, man. Give me a break." But
I know we're making light of it, but
I know.
I know what you almost have to, don't you?
it doesn't affect making light of it and trying to make the lemonade out of lemons.
Sure,
is what
sure.
Americans do.
That's right, we do that.
It doesn't
But
hurt a
you
thing.
talk about the number. I don't know if we really realize it. We have 330 million people in this country, 330 million, and we know. I think I read numbers that 8,000 people a day die in the United States. It's normal before COVID. I mean, that's just the normal churn of people, that die. We talked about these numbers, and try to put some perspective to them. If you just, when we know of the flu and everybody thrown out numbers about the people that had the flu die, and again, not diminishing that, but the numbers just don't, we're all having all turned into zombies. It's
Yeah,
kinda
you
like,
mentioned the 330 million population in the country. Well, I checked this morning, 91,664 people have died in the U.S. from this. That's a terrible number. But we haven't created it. It's not because somebody was incompetent, in the U.S. It's something that happens in reality that we can't escape from. We just have to accept as part of our life. And that number of deaths compared to the population is what? 0.003 rate of death. Well, like you said, 8,000 people, was it 8,000 people a
8,000
day?
people die, I read somewhere, yeah.
Of all other causes?
Sure, just die because of automobile accidents, old age, you name it.
They get old, they fall off a ladder,
And of course, we got so many, we must have 8,005 must be born because we always grow a little bit. There's a lot of things we just don't realize,
Yeah, unfortunately.
You're only on page 1. We got a long way to go.
I know.
I'm sorry if I'm distracting you.
Not
here,
at
Gary.
all, not at all. I like a good conversation.
This is what it is, a conversation.
You're right. This is just not a dissertation.
No.
But, they put these restrictions on trying to make everybody safe and reduce the impact on society. But they were short-sighted. They tried to make these decisions based on the data that they had back then, and they take worst-case scenario. They've got to shut everything down rather than trying fit the solution to the problem, because the unintended consequences and other facts about this matter are overwhelming. We've got 38 million unemployed people now. That's crazy. We had the best unemployment figure in the country that we've ever had in our history 3 months ago.
Right.
It's crazy. the hospital finances are in the tank because the governor shut down the elective procedures, and that's one of their high profit margins. That's really how they survive.
Right. We didn't want to overwhelm the healthcare service, but now they're laying off 40% of their nurses.
Yeah, yeah. So they can't. They have to be concerned about taking a very light approach to fixing a problem, because they never can know all the side issues that they can't think of. And,
but then on the other hand, though, a politician / leader makes a decision, it don't matter what it is, he's going to be wrong to half the people. I mean, you're going to have half the people agree with it, and half the people think he's a nut.
Well, I think our governor, being a physician, did not work out in our favor here, because what he had was blinders on. He was only going to look at the health ramifications of this. And that's what's happened at the federal level also. You've got, Dr. Fauci, he's the expert on this. Whatever his opinion is what needs to be followed. Well, no, his focus is on health issues, and you can't view anything in such a limited perspective. You have to sit back and take the 2,000-foot level view and not the 100-foot view.
Right, it looks different.
Exactly. We have $3 million of federal stimulus spending in response to this just so far. That's a tremendous number.
$3 trillion.
$3 trillion.
Yeah.
Did I say something not
$3
trillion?
million. I thought you said.
Oh, man, I don't know. I'm old.
$3 million today.
I'm old.
$3 trillion, right.
If you misspeaks.
And more is coming,
Yeah.
or trying to get coming.
And the Federal Reserve, I think, has injected $6 trillion to address the liquidity in the financial markets,
right,
to make things good. So this is all debt that you and I are going to have to pay. It's easy for our politicians today to say, "Oh, well, we'll spend all this money and fix everything."
Well,
and somebody else can pay for it.
Well, and you know who buys our debt right now?
China.
So we're going to owe money to China.
And they're not our friend. Yeah, you know what? I think we ought to get some of that money back, because they're the source of all this problem. But let's see what happens. Let's not address that now. The money that's been spent, the stimulus and the Fed stuff, if we don't see inflation from that, then we'll never see inflation. This is crazy. And what that is that will be a hidden tax on people, because the value of their money is less.
Exactly.
So, that's just another factor that in and of itself is just a terrible consequence of shutting the economy and society down. I heard Dr. Mark Segal the other day. He is a professor of medicine at the New York University School of Medicine, and he was explaining that the shutdown is producing disastrous results. He says, from what's called the disease of despair. And the disease of despair has to do with desperation and anxiety and depression that's been caused by the shutdown, and it will increase deaths in 3 categories: overdoses, suicides, and alcohol-related diseases. The overdoses will happen both from alcohol poisonings as well as drug overdoses. And in 2018, the disease of despair deaths were 158,000 from just normal problems in an economy that was the best we'd ever seen. Because of the shutdowns, the estimates are between 75,000 and 150,000 more deaths on top of the normal and on top of the COVID deaths because of the shutdown. So this is the evidence that what I said back 2 months ago is true. The cure of the shutdown is worse than the disease. And if no other factor that I mention here today is accepted by the local and the state and the federal people, it's that number alone. By them recognizing that, they should say, enough of this. Yes, we're going to open things up, and we're going to see more cases, and we're going to see more deaths. But we're going to see less if we keep the shutdown in force. So we've got to stop this madness and open this up as soon as possible, tomorrow. So What else do I have here?
Well, our town is trying to open up the town this weekend. They want to open up or close down Main Street, open it up from Saturday till Monday. And I heard from a lady that has a restaurant on Main Street that she just got her approval from the ABC board that allows them to sell alcohol out on the street
Outside the
from
premises.
2 o'clock on Saturday until 7 o'clock Monday night, I think she said. So,
Good.
and because the town has signed off on it and approved it, the ABC, which is the state now, is going to say, well, you know, that's okay then. So that the idea is it's trying to help out these businesses.
You know, fortunately, they're able to do that because that's under the Phase 1 guidelines.
Right.
You can have outside restaurant
Well, the idea
business.
was the governor said 50% of your existing outdoor space. Well, Main Street isn't existing space.
Is
so
it outdoor space or is it
outdoor?
of
No, outdoor.
your approved capacity?
Outdoor capacity.
Okay.
So they're still not allowing any indoor seating.
Well, then the town would be in violation of the government's Phase 1. I don't think they are, but
Well,
we'll have to check on that.
We'll see, but it opens up a conversation that you know.
You know, it's great that the town is taking that, that action. And I believe the last council meeting, they approved a resolution that went to the state a week ago that said, one-size solutions don't work. We don't have a problem out here. Yeah, you got a problem elsewhere, but your solution is applied to everybody.
Right.
Why not delegate authority to the local officials who are more knowledgeable about their environment, their circumstances, and grant us authority to open up differently than your broadcast limitations.
Goes back to choice.
And I haven't been in touch with the mayor yet to find out if there's been a response from the governor. I will bet you there's been no response, because if there is a response, it's going to be no. Because by saying no, that would mean that he didn't come up with the idea to have multiple solutions for a multiple environment state.
Right.
And makes him look bad.
Well, I heard that in his briefing that it was not going to be regionalized. However, they regionalized by extending the shutdown in certain areas.
They regionalized the negative part,
Right.
not the positive
Exactly,
part. They
right.
granted some jurisdictions the ability to not progress to Phase 1
Right.
and stay in Phase 0 because you people have more trouble there, so we have to keep you slapped down.
Right.
I don't know. So I agree with what the council has done. What they've done is they put their toe in the water. You know, I want to leap into the water. They ought to say, I was elected by the people of my town to represent them. My people don't see that the risk is great out here. They don't want me assessing the risk for them. I represent the people, so I'm opening it up. I'm not going to have any repercussions based on what the governor says. Have at it. Yep, we're going to have more cases, we're going to have more deaths, but we're going to have less than by keeping it shut down.
Right.
Because that's what's in the interest of the people. Now, I had a conversation with the chairman of the board of supervisors, and he's not so willing to buck the governor. In fact, he's right there pushing the interests of the establishment. And I was extremely surprised. I wanted to have a dialogue with him about the actual facts and details, but he is so strongly entrenched that he said there's no sense in us even discussing it. We're just going to have to agree to disagree. Phase 1 is what I'm going to, keep in place. Mm-hmm. Because if you'll notice what's happened, the public being able to attend the Board of Supervisors and council meetings have been shut down. So they've had a little more free reign. They haven't had to, had the participation of the citizens and the government.
Sending them a text is not the same way as staring them down eyeball to eyeball, is it?
Well, here's the other day. They had a Board of Supervisors meeting on Tuesday. I sent an email in, and I wasn't explicit in how the sections of my comments were to be addressed against the issues that were on the agenda. So when a public hearing came up that I had a comment for, it didn't get read. It got read in the general comment section, which was after all the public hearings was over. So it shows how that doesn't work. And I think they have recognized that that the public participation needs to occur. and they're willing to move forward, but they're not willing to buck the governor,
Right.
because they could open up the next meeting on June 2 and allow people to come in and still do physical distancing. We could still wear masks. They can still disinfect the areas. They can still limit the whole number of people. It's a huge boardroom. We typically don't have that room filled with a bunch of citizens on issues, except a couple times a year. And we didn't even have it this year because we have a board now that's much more responsive to the citizen.
And give Supervisor Mabe the credit. He lets the public speak.
He does.
Yeah. So
I've been a supporter of him, but him and I are at loggerheads on this issue, and I helped promote his election because he was not looking to be the establishment. He was looking to be a representative of the people.
Right.
And this, I think, is just a little counter to that. So I'm hopeful that he's gonna swill this thing around in his brain and say, you know what, maybe we ought to make a little modification.
Right.
But fortunately, it's not up to him. It's up to the Board of Supervisors. So I'm going to be contacting the rest of them and say, hey, look at the facts here. It's time to do something different. If the governor is not going to demonstrate good sense, then we want you to demonstrate leadership by saying, we're mad as hell and we're not going to take it anymore. And our citizens don't want this shutdown to continue because the facts say otherwise, and we're going to open it up. So we'll see what happens. The solution to this whole thing my ideas about the solution to this whole thing is as follows. Immediately open society and all business except large assemblies, such as the indoor concerts and sports arenas where you have people sitting shoulder to shoulder. Let's hold off on that for a while.
Let them figure out a way to social distance.
I don't know that they can, but maybe they can just limit attendance.
Right.
Instead of having a 15,000 person stadium, have a 3,000 person stadium or a half, let half men. And again, you let the people decide for themselves whether they want that risk. And even if you're not 6 feet apart, if you're wearing a mask, you're pretty much protected. If you're infected and I'm not, and you're wearing a mask and you sneeze, your mask is supposed to catch most of that.
Right.
So again, let the people decide what the level of risk is. Those with symptoms or are tested positive, they're the people that need to stay home and not infect everybody else. They need to get back healthy again. And if they have severe symptoms, they need to go to the hospital and get remediation. Get healthy again. The contact tracing that the governor seems to be relying on is not really all that meaningful. That concept works at the start of things. It doesn't work when the horse is out of the barn, so to speak. So we're going to try and spend a lot of time doing that, and it's going to be a lot of expense, and it won't produce a lot of positive results. So I'm not going to be
Well, I know they want
focused
you
on
to
that.
come and keep a list of everybody that's been in your building and start taking names and numbers and addresses of your customers. And I think that really rubbed a lot of people the wrong way.
I will not comply. I won't do it. I'll contact the people I've been involved with and say, hey, you need to be careful and check yourself for symptoms and stuff. But if you think I'm going to be interrogated by some government employee about how I've run my life the last couple of weeks, they got another thing coming.
Right.
So, and they keep talking about all this testing too. Well, you test the people with symptoms. You don't test everybody because you can't test everybody every day. The test that happens today is not valid for tomorrow. You
That's
get
right,
disease
exactly.
tomorrow.
Yeah, 2 hours from now could be different.
This is what's nuts about this whole thing, about the testing.
Yeah,
So,
people think that once they're tested, like it's a one-time deal. It's only good at that instant.
At that instant. Now, I had what was diagnosed to be a bronchial infection back at the end of February. Mm-hmm. And then they tried to treat that, and it didn't get any better, and they reassessed it and said, man, you got walking pneumonia now. So, I had a problem, and I got antibiotics, and it went away. Cough happened for 6 weeks. They told me, you're going to keep coughing until all your bronchial areas are clear of all the bad cells that, have been fixed by your medicine. But I'm wondering now if maybe I didn't have the COVID-19.
Well,
So I'm going to go in and get a test to see if I've got the antibodies, because I can give my blood and they get the plasma out of there and help some people who are really sick.
right.
So the antibody test I'm in favor of. If you've had the disease and think you might have had the disease, that makes sense, because now you get a positive result out of that.
Right.
So the at-risk population, the very elderly, and the people who have underlying health conditions, they should self-isolate. They should limit their contact with the public, because they put themselves at the worst risk by doing that. I've got an 89-year-old mother. I've got an 80-year-old uncle that lives with her. When I go down there, they make me wear a mask, even though I know that I'm not infected. Now, of course, I could say you could be asymptomatic, but the CDC says that if you're asymptomatic, your risk of infecting somebody else is extremely limited, because it's the symptomatic people who are the most contagious. And they've just come out with a reduction in their advice about surface contacts, getting the disease from other than person-to-person contact. Mm-hmm. They said it's highly unlikely. The disease degrades so quickly, and it's in such a small concentration that you would come in contact and touch your eyes or mouth or
Speaking
nose.
of the nursing home, I just spoke to a person that runs a local nursing home. They have 0 cases of COVID. They had no infections whatsoever. They've locked it down. They're going through the process, and we know that that's where a lot of people are susceptible. But they've been able to, at their choice, to control this,
Yes.
and have protected their residents.
They put their proper level of mitigation against the at-risk population. And they didn't do that throughout the country. If you take a look at the 91,000 people that have died from COVID already, it's something like 30,000 of those are in the elderly care facilities.
Well, and the governor, they were treated, went back to the hospital, and they allowed them to go right back into the nursing home.
In
again.
New York, they were forced to accept those people
That's right,
back in.
forced to accept.
And over half of the people that have died in New York are in those elderly facilities.
Right.
So you better be cautious about listening to what the government tells you. They can hurt you and not help you. And that's why it's important for the citizens to pay attention to what the government is doing. And when they stop being a positive influence, let them know it's time to back off and what's the proper role. And that's what I'm trying to do here. And that's what the citizens who are demonstrating throughout the country now are saying. The economic damage and the damage to the fabric of our society.
What makes us Americans?
Is what makes us, individually free is being so damaged by this. We're not going to put up with it. I messed up. I wanted to come in and bring some of my signs. I created some signs, and
You're the sign guy.
I've been on Main Street as a sole demonstrator several times out there with a sign.
We have quite a few pictures of you with your signs.
You do, yeah. My voice is going to be heard until I'm gone. Whether they want to hear it or not, I'm here to stay.
Well, like I said, this is a conversation starter,
Yeah.
And we want people to just listen to it. You don't have to agree, but think about it.
Food for thought.
Food for thought.
Yeah. So the public should continue to keep physically apart when reasonable. In Warren County, we've got so few cases. It's a little more easy for us to be closer to one another, even people you don't know, if they're not coughing and sneezing. The public and the businesses, they should continue to surface disinfect. If you're going to open up to the public,
Sure.
at home or in businesses, hey, let's get rid of the disease when we can. Let's do what we can do. Let's do what's reasonable. But we get a bang for the buck. Everybody should continue practicing the improved personal hygiene. I know I've been washing the hell out of my hands.
Right. Nothing really works better than soap and water.
Nothing works better than soap and water. You don't, in fact, you want to limit your contact with these antibacterial stuffs.
Right. We already know that they're not good for you.
They're taking good bacteria off you as well as the bad bacteria.
Exactly.
Because the thing that protects us, our immune system, is fed by bacteria that causes us to generate the immunity to the bad stuff.
Well, you always heard about the kids are getting sick because their parents wouldn't let them play in the dirt. As we did as kids, take your little army men outside and we played out in the dirt for hours and hours and hours. And now they're putting the antibacterial cream on your hands.
I'll tell you how bad it gets. I had a family member who had a child, and she was kind of a germaphobe. So she limited her kids' contact with the outside world. When they went to restaurants, they took their own placemats, they took their own cutlery. Mm-hmm. She bought the antibacterial stuff by the gallons. So I kept telling her, I said, you know what, you're not doing this kid any favors here. He's not creating an immunities to these things, a little bit at a time. But she didn't listen. Kid started school. He was sick all the time, and he was seriously sick.
Right.
So now he's
because all his friends had yeah.
That's right. They had immunities to the stuff. They were bringing it in. He got it. Man, he was in bad shape. So, but they don't listen to the adults that have gained some wisdom from getting old.
Exactly.
So
and getting all these diseases.
Exactly. Yeah, but a little bit at a time. We can handle it.
A little bit at a time. Exactly.
The people should independently determine their level of risk and live their lives accordingly, and they need to determine whether they wear masks or not. When I go into Walmart or Aldi, I don't wear a mask. I don't need to. Everybody else is wearing a mask. If I was sick, I'd stay home.
Family. If you have a large family, you're around these 10 people all the time. And they're out and about with people. So, they said, well, if you're a family, you can do this. And, there's no social distancing in a family. But yet those same families are all through the community around a lot of different people. But yet we're back into that close. And yet we're not seeing families get sick like that.
Yeah. What we want the government to do is we want them to continue to plan for the worst case scenarios. We want them to have plans in place that if there is a big spike and we start to overwhelm the hospitals,
we can take care of it.
What are we going to do to create more medical facility areas? We want to make sure that they've got good stockpiles of PPE, and we want to make sure that if that gets consumed, that they've got a way to deal with that. Now, the governor has done a pretty good job at that. I'll give him credit. They've obtained a bunch of PPE, and they've actually gotten some machines that will clean the PPE, so it's more than one use. Mm-hmm. So they've done a good job there. And they've looked at the hospitalizations and said that, okay, we're in good shape there. The amount of hospitalizations is not pressing our levels.
Right.
So we've got a plan to address that. But once they do that and prevent it from getting out of control, then they should open everything up. But he hasn't. He's got this ridiculous phase thing. Power corrupts, and it goes to their head. What value is it, Mike, to have power if you don't use it? So they become power drunk.
Well, and people take about as much power as the people are willing to give them.
Yeah, I had it. I had my limit at day one when he said, "You got to be shut in." Hey, where's the car keys?
That's right.
I'm out of here.
I don't know. I don't have to go anywhere, but I'm going. Right?
I'm not an authority kind of guy, I'll tell you. I'm a liberty guy. So, that's what we expect them to do. We need to have them keep track of the numbers, see what the spikes are doing, make sure there's mitigations available if things start to go south. They need to keep informing the public of new things that they learn.
Right.
Like the CDC saying, don't be all that alarmed about the contact contagion, because that's not a big deal as we're learning over time.
And they found out, they've discovered some things by now that they have more data. And I think that they are trying to do that. It's just that how do they use the data? And of course, the wheels of government turn slow.
Yeah, it's a shame. The government should only be implementing the stimulus spending from here that is absolutely necessary. It should be well thought out. They shouldn't just, throw something together like the Speaker of the House did in the last week when she was on vacation in San Francisco, eating her specialty ice cream out of her specialty freezers
behind her wall.
Yeah, the rest of us should eat cake.
Right. Exactly.
So, man, we need term limits. We have got to get these fogies out of here.
Well, but that we have term limits. It's called the voter box. But
I know,
the ballot box, but
the population gets so apathetic. Look at the percentage of people that vote.
I know.
That's absurd.
It's very low.
I mean, I would do whatever I need. Times when I've been away on election day, I've got an absentee ballot. My vote is going to count. So
Yeah, we all really need to do that. We got to realize that the old saying is, "You get the government you deserve."
oh, exactly, yeah. You can't blame the government. You got to blame the citizens because they allow it to happen. If they do any more stimulus spending, it's got to be specifically targeted. They've messed up a little bit with some of the stimulus spending they've had so far, and they try to give you excuses for it. But allowing these big businesses to get this money with 500 employees was not a good idea. It kept the money from the small businesses.
Right.
And the banks got to favor the big business people, the big customers over the little guys. The big guys have got a lot of money, a lot of resources. They've got options. The little people don't. That's where the money should have gone.
They have options to borrow where the small businesses can't. And the thing that really I'm concerned about, because, we did get a PPP loan, which the rules change every day. What you think the rules are when you got it, now there's a new set of rules. But we've already borrowed the money under the old rules, but we don't know what the new rules are going to be. So there's this uncertainty whether it's going to turn out to be the way you want. It may be better, but it could be worse.
I'd be surprised if anything's better from the government. So they need to target any future stimulus spending, and it needs to be temporary. They can't keep printing money.
We've got people out sitting at home making more money than when they work.
Yeah.
And they don't want to go back to work.
Yeah, that's another thing. They've got to have restrictions in here to where the programs can't be abused, because I've heard of businesses now who've complained that they've gone back to the employees and said, we're ready for you to come back. Said, I'm making more money. Why should unemployment benefits be more than what their salary was?
But of course now they've also started. If that happens to you, if you're a form, you fill it out, you report it, and they'll cut off their benefits. So they're trying to stop that.
I heard Mnuchin say that.
He did say that the other day. But
how many of that's going to fall through the cracks?
Well, it's got to trickle down to the local level. It's going to take a while.
I'm sad to think about all the people that take advantage of that kind of stuff. My sister was on unemployment for a while, and she made a mention, well, I've got X more weeks number of unemployment back. I said, that's not what you should be determining on whether you go back to work or not. You should be out there finding a job and getting back into the workforce. You're responsible for supporting yourself as a responsible adult, not living off somebody else's tax money, which is what you're getting as an unemployment benefit. You either are contributing to a problem or you're causing the problem.
Right.
So that's your personal integrity. And that's something that when you lose it, it's hard to get back if you can get it back. So you got to look at yourself in the mirror. You know whether you're an up-and-up player or whether you're scamming the society. So, but it takes a whole lot of different kind of people to make a world, doesn't it?
It does. It does. Takes a lot of it. It takes a lot of us.
That's right. So, let's be careful with this stimulus spending. And I don't want any money to go to the states and the local governments that is not directly in response to their COVID expenses.
Yes, we've heard about trying to bail out pension plans where some of these states have been poorly run over the last 10 or 20 years.
We can't have that.
A lot of blue states.
We can't have that. The House of Representatives has passed this recent another $3 trillion stimulus bill that thankfully the Senate and the President have said is dead in the water.
Right.
We're not. You hosed us the last time around, with money for some of your pet projects, blackmailing us into doing something good for the American public. But we're not standing for it this time. You're going to have to.
Because there's consequences.
Absolutely.
And they're looking at it. Yes, it's going to help some people, but it's going to hurt a lot more people than it helps.
Yeah. Well, I'm not supporting any of that $3 trillion House passed bill. And I know Klein didn't.
No, we're getting to the end here. He's on the last page, so we'll finish this thing up.
We are. We need legislation and incentives to fix the supply chain and bring that stuff back from China.
Aren't you shocked by how some of our pharmaceuticals sole sourced in countries outside, not just China, but several other countries that have just are the only source for And this happened before in our ammunition.
Yeah.
It happened.
Ooh.
We had
Right.
we had ammunition. You couldn't. The key ingredient
Missile parts.
came from China. I read an
Trump's been
interesting.
fixing that.
I read an interesting story about the SR-71. You know, it's made out of titanium.
Yeah.
But the source of it is Russia, and so the secret here, the government sets up all these shell corporations around the world to buy titanium to
Because
shuffle
the Russians don't want to give it to us directly.
exactly. So they
can play that game.
They can play that game, but it's the same thing. You know, we've got these ingredients. PPE is a good example. Again, we've outsourced so many jobs and merchandise in our business of making CDs and cassette tapes. The only manufacturers of some of those products is China.
Yeah, I don't
Taiwan.
think any TVs are made in America anymore.
Yeah.
So, Trump's been nibbling at that up until now, but it's really in the public view now.
Now people are starting to see it.
Yeah.
This has brought out this disaster has brought out some good things as well.
It has.
Some things that opened our eyes to say, whoa, you're right. I didn't realize. I didn't know that.
Yeah, the problems with the supply chain is a result of our business greed, our consumer greed, because we want the cheapest price possible.
We want the cheapest price, but we want to be paid the highest wages.
Yeah, right. And so I think that we need to change the powers, the legislation in Virginia to limit the powers of the governor. So the next governor can never do what this one's done to us again. I think we need to have limited authority in emergencies. You give them a window of time to start something, but then the legislature's got to get back in and say, we're not just going to allow one person to be a king over us and make stupid decisions.
That's kind of how we got it. How our country began. We're not going to let a king tell us what to do.
Yeah, we've been here before. This is deja vu. A couple of hundred years ago.
Right, we've been here before. This seems so familiar.
And let's hope that we don't have the same kind of remedy to that was necessary back then. But don't believe for a second that we couldn't get to that point. So we need legislation that eliminates, that changes up the authorities of the governor to hose us like this one has. This is an economic impact to our national security. Because our economy has gone downhill, we're much less able to address the external threats. If you think about it, how did we win the Cold War? We outspent the Soviet Union on military products.
Right.
That's how we brought them to their knees. So now we're diminishing our economic power, which affects our national security.
Well,
so
I just read this morning where the Army
open things up.
The Army's got 24 projects they're working on for future, and all of a sudden all that money's being diverted to something else because the income. It's a catch-22 on some of this thing. So it's affecting everybody, affecting our military.
You're right. Even if they open up the economy tomorrow, put it back the way it was, and accept the level of COVID damage that we're going to see, the economy's not going to come rushing back. The fear that's been injected into the populace can't be just eliminated with a swipe of a pen, opening things up, because the people have had economic downturn from it. So now they don't. When they get money again, they're not going to run right out and spend it. They're going to save it for a more rainy day that they've just been through.
Well, it's trust. And that's what it boils down to. This fear that we have has permeated our culture, and that people and I heard people all the time. Well, I'm not coming back to work. I'm not coming back to church. I'm not coming back here until it's safe.
It's never going to be safe.
Yeah.
That's an illusion. There's only varying degrees of risk. So Americans are stronger than that, though. They'll be fearful for a while, but when they see other people getting out and about,
all of a sudden they're fearful,
and their lives getting better, they'll say, "Hey, wait a minute! They're having a good time again. I'm going to have a good time again too."
Exactly.
We're going to have businesses that are not going to come back.
Yes.
So not all the jobs are going to come back. We're still going to see a higher unemployment rate, a lot of businesses have noticed that we can get away with a little less employees than what we had before.
And do we need to have all this office space in New York City when
commercial real estate going down the tubes?
But also we're going to have new businesses created out of this.
We will.
So we're going to have the entrepreneurial spirit that we have in America.
Absolutely, the American spirit.
We're going to create probably so many more jobs than what, kind of like people say, oh, the automobile industry went to robotics. Yeah, but we replaced a worker making $10 an hour with a technician that's making $100 an hour to fix the robot. So, jobs.
We're going to bring back supply chain too.
So I think we're going to see jobs come back sooner than some people expect.
I don't think it's going to be like the president has indicated.
Well, but that's what we need.
It's not going to come rushing back.
No,
but it's going to come back.
Exactly, but I think we need that positive spirit that says, things are going to be okay. They're going to get better.
Who do you think is better suited to manage a reinvigoration of our economy? Somebody who's demonstrated that they can do it, or somebody who has
in the basement.
been in charge of lackluster economy?
Right.
I mean, come on. We got to go with the guy who has gotten the job done. So, so the bottom line here is that we have to open up. We have to accept that there's going to be some pain to it, but it's unavoidable, and that pain will be less than the impact if we don't open up. And again, there's no magic bullet in our future to this. There's no vaccine guarantee. So even if they open up on the governor's phase schedule now, we're going to see more disease and more death.
Well, I think we put so much emphasis on, like you use that fear. Until they get a vaccine, I'm not coming. But this is a virus. Viruses mutate and change. We've had vaccines for flu. Every year they have a new vaccine.
And we still have 70,000 deaths.
Exactly. And that the vaccines, they mutate because, that vaccine was good on last year's strain, but it's not good on this year's strain. But if you take the vaccine, you get this year's less result.
Yeah, I know.
It's something that there's, like you said, it's a degree of risk.
The politicians have been out there saying, oh, we're making these decisions based on science and fact. Well, I just gave them some facts that are the truth. They can go look them up themselves. Don't take my word for it. The damage to keeping the economy closed is worse than opening it up. So let's stop this madness and open things back up and give the freedom back to the people to determine their risk and live the life that they want to live.
All right.
So that's all I got to say.
That's all. Well, Gary, I appreciate you coming in, talking to us. It's a good conversation starter. You may agree, you may not agree, but think about the things that Gary's talked about today and look it up and see, if you're willing to take the risk, what it takes. It's even if we opened it up, it's not going to be like turn to switch. It's still going to be a gradual process because there's people that they make choices.
Email or call your council person or your board of supervisor representative and said, enough is enough. Stop being a supporter of the establishment and represent the people who elected you. Open this county back up and call your adjacent jurisdictions and encourage them to do the same thing because their citizens are in the same position as the Warren County citizens.
Well, it's all about politics. Just like you mentioned, the large stores. How do you think they got to stay open? I'm just saying.
Yeah.
Because,
exactly.
They can afford to influence the politicians where little mom and pop places can't do that.
Yeah, the big companies gave campaign contributions to the politicians who allowed them to take the supply chain over there for cheap labor. Greed and corruption, buddy.
Yeah, we got to watch it.
That's where it is.
Well, it's a thought, so keep in touch with us. Let us know what you think. I'm sure you will.
What did that guy say? I'll be back.
I'll be back. So we'll touch base with Gary again in a couple of weeks, and we'll see what the fallout is of your comments and see how many conversations we can get started.
Thank you, buddy.
Thanks a lot, Gary. Oh, wait a minute. I get the infection.
You said you weren't affected.
I know. We got some wipes over here. We'll have to take some sanitizer.
All right.
Thanks again, Gary.
All right. Bye-bye.